And there we are. We're live on Facebook, Ann.
Wow.
Yeah. Hi, everybody. This is Pam Sadler again, and we are today going to talk with Ann Usted. She's been a friend of mine for a while. We've both been in the Michigan Holistic Nurses Association from way back, where she did publicity, and I was the secretary and then the president of the Holistic Nurses Association there in Michigan. And so we've become really great friends over that time. And she works at the Downing Clinic in Clarkston, Michigan. She's got kind of a unique take on healthcare because she works in an integrative practice where they do both conventional medicine and natural medicine. Oh, let me turn off my phone. So, Ann, go ahead and share what you have there, okay, for some health benefits. You said you've been seeing some health benefits from your clients coming in.
Yes, it's been unique. Thank you, Pam, for this invitation. And because I had been having these thoughts and I didn't know who wanted to listen. So we've been going through a surreal experience with the shutdown of the world economy and our extreme health risk. Many have taken the time to reflect on their lives. The people who have recovered from the COVID-19 virus have found refocus for their lives. And this discussion will show all of us we can go out of quarantine with a new lifestyle habits and a new outlook on life. So it's interesting to note, while evaluating my patients at the Downing Clinic over the last few weeks, I've noticed some of them show an exponential improvement in their health status I hadn't seen before.
Mm-hmm.
I used electrodermal screening at the Downing Clinic. And if you don't know what that is, I can measure the electrical resistance of the same channels an acupuncturist will treat. You can, the listeners can learn more about it at thedowningclinic.com and look under services, and there's more information on the electrodermal screening. So I can detect early changes in a person's overall health status. An example is an engineer who years ago became a stay-at-home mom of 3 active boys. She's been seeing me and the doctor at the clinic for about 3 years. Cleveland Clinic and many other doctors weren't able to help her with the POTS syndrome. And POTS is P-O-T-S. It's postural orthostatic tachycardia syndrome. So it's a heart condition that involves the body's blood vessels. Symptoms include that she's complained of are lightheadedness and fainting when standing from a seated or lying position. Often the only relief is lying back down. And doctors don't know exactly what causes POTS, but episodes seem to begin after trauma, major surgery, or a viral illness. So she has improved greatly over the years, but still had frequent sinus infections and some days was feeling weakness. So to make a long story short, since her family is in quarantine, her health has improved, actually. Her husband is working from home now and able to help manage the boys and the small farm with the extra time he has since he isn't having to commute. He homeschools the boys, so the only change in her schedule is not taking them on frequent outings to the homeschool science fairs and sports. They aren't going to museums or aquariums either, so she has a more settled routine. Her readings were much improved, better than I'd ever seen, and her swollen lymph gland on the side of her neck, which has been there for over a year, has disappeared.
Wow.
Yeah, so we were just amazed, and we talked about it. I see the results instantly while we're testing. So I've got another example of a woman who's still working outside the home. She's a female frontline nurse. She works 3 days a week on a 12-hour shift at the hospital caring for high-risk newborn babies. She's starting menopause and has thyroid changes, and our doctor is testing and treating those things. She also has Lyme disease and has reported over the last year or so that I'm so tired I can hardly move some days, she says. She's complained of brain fog and achy body and belly discomfort, gas and bloating, mild nausea, and generally she was finding life quite difficult. I can hear the drone in her voice. But we have made some progress with her symptoms, but her condition changed all the time. And I was starting to think that it was related to the stress that she was under.
Mhm.
Well, last week she came in with bright eyes and a cheerful lilt to her voice.
Awesome.
Yes, and she was talking about the challenges at work and didn't mention a thing about her own symptoms. So when I tested her, I found the readings were much better for her too. And when I pointed out what I was finding, we were both amazed, and she admitted the brain fog and belly problems and fatigue were basically gone. And when discussing the supposed benefits of quarantine, because I'd already seen the other woman, she admitted her older children were home from college and were helping prepare food. The younger children didn't need her to transport them to school. Her husband was working from home, so he had time to help more. And she's been spending the time to focus on the mindful meditation and stretching exercises we had discussed on previous appointments. And she hadn't really had time to do those as much as she was when we were in quarantine.
Mhm.
So she started really noticing benefits that of she could feel it, that she was
Right.
more relaxed and she could notice. And so I don't know how much time she's spending, but she was able to spend more time. I have another example, another woman. She's a female swimming instructor who was having constant infections and fatigue, so she could hardly get out of bed. She made improvements using the supplements and intravenous nutrition, but her body was making slow progress with repairing her adrenal exhaustion. The other day I saw her at the counter in the clinic and she came in to pick up supplements. She looked bright and chipper, and I was just looking at her, but I didn't have time to talk with her at the moment. So I called her the next day, and she said she was out of work, but her husband, you know, 'cause she worked at the school
Mhm.
with the swimming, and so she was out of work, but her husband was working from home, getting home repairs and projects done. Her children are home, and they're all having good family time. And she's been able to do yard work, get more sleep, keeping her regular schedule. She's cooking more organic vegetables and meats from scratch. They aren't eating restaurant takeout food to save money, and she feels better than she has for a while. She admits this temporary lifestyle change feels good, and she will continue some of the activities after this is all over. She'll have to sort out her life.
Yeah. So kind of the basic thing you're saying is that everybody's been overscheduled, to put it simply, right?
Exactly. So I'm wondering, because I've noticed some improvements in myself too, and so wondering what kind of life we're going to have later and what we can do different.
Right.
So I've got one more example I actually heard on the news,
Okay.
and it's a new discovery that the hospital infections and infectious disease department heads are reporting a sharp decrease in hospital acquired infections. You know, people go into hospital and sometimes get sick from something new.
Right. Oh,
Uh,
often.
we see
Often they
that as
do.
nurses all the time, yeah.
Yeah.
So this improvement has attributed to an increased use of masks, gloves, hand washing, protective disposable clothing the staffs are wearing, considering everyone infected and highly contagious. Now, we've had universal precautions for a long time,
Mhm.
but everybody's really taking it seriously. So I'm wondering, as we leave quarantine, if the rest of our life will have a new normal. The hospitals will use more infectious disease precautions, and so will we. That we'll be more conscious of infections transported on our mail and packages and doorknobs and gas pump handles. We'll wear masks and gloves, particularly during flu season when going to the store without being considered strange. And we'll all be more methodical about our hand washing and touching our faces with unwashed hands. And so I think it's going to be interesting to see what we can do with our lives to not go back to the crazy schedules that we had, and maybe have some improvements in how life has been.
Right. I think so. And I think there has to be a balance, because so many people, we've noticed over the years that some people are really rigid about how much they really clean everything, and that affects the immune system as well, because some of the cleaners are toxic,
Yes.
and because we don't build immunity to those bugs that are normal out in the community. So
Right.
this virus has been different because it specifically attacked the lungs, and we've seen, so many people that needed respirators at first, especially those that had comorbidities. But and then those comorbidities where they have cardiovascular disease and respiratory conditions and diabetes and things like that, a lot of those things can actually be helped. And actually, using some natural medicine approaches and good nutrition, a lot of times we can help these people so that they don't have to have all of these things long term. And our doctors aren't trained in nutrition as a general rule. So it's really wonderful at your clinic where you've got a doctor that is trained in nutrition and all of those aspects that can address that in an integrative way. So you're using medicine when you need it, but you've got all those natural approaches that help support the body to heal itself.
Yeah, it's one of the interesting things. I think that the whole country has discovered vitamins, minerals, herbs, and healthy eating, because we've had a terrible time at the clinic with getting the products that we've been ordering regularly for decades.
Right, exactly.
And they're out of stock because they're being sold to everybody is coming and buying at all these different places. And so the manufacturers, of course, of these supplements and things weren't ready with that one.
Right.
We weren't ready with a huge, stock of
Inventory.
things.
Right.
Who could be ready for this?
Yeah, exactly. Well, we've got a new normal, and people will know more about what to do to heal during the
Yes.
flu season every year, and they're going to get outside maybe without sunscreen and get some real
Yes.
vitamin D for at least 20 minutes a day in the summer, and take vitamin D3 with K2 in the wintertime when up there in Michigan and all those things. So, well, we're out of time. but thank you very much today, Ann. It's been really interesting to hear those examples of what you've seen with, to really have something where you can see readings of how people have changed. So
Yes.
yeah, so go to the downingclinic.com, right? Is the name,
Yep.
is the website, and
Yep.
you can learn more about Ann and what she does and what Dr. Kowalczyk does there. So, all right, everybody, have a great lunch. Take it easy. Bye-bye.
Thank you.